Welcome back to our channel. We provide you detailed information on medicines and drugs to help you inform your health. In today's video, we can talk about thiamine injection week coverage, uses, benefits, side effects, how to use and how it works. Let's get started. Manufactured by Ordain Healthcare Global Private Ltd. Thiamine injection. Uses. Thiamine injection is primarily used to treat nutritional deficiencies, particularly vitamin B1 deficiency. Benefits. Vitamin B1 deficiency can cause serious health problems, including weakness, nerve damage, heart issues, and conditions like beriberi or Wernicke-Korsakoff syndrome. Thiamine injection helps replenish vitamin B1 levels in the body, supporting nerve function, energy production, and heart health. This restores normal body function and prevents complications related to the deficiency. Side effects. Like all medicines, thiamine injection may cause side effects in some individuals. These include pain, swelling, or redness at the injection site, rashes, itching, allergic reactions, difficulty in breathing or swallowing, cough, decreased blood pressure, facial swelling, and increased sweating. If any of these symptoms persist or worsen, consult your doctor immediately. How to use. Thiamine injection should always be given by a doctor or nurse. Do not attempt to self-administer this medicine. How it works. Thiamine injection works by replenishing essential nutrients in the body, specifically vitamin B1, which is vital for nerve health, energy production, and overall well-being.